Hello everyone, welcome to your lecture on assessment, which is the first step of the nursing process. These are the learning objectives we will be covering in this lecture. Please go ahead and review your assigned chapters from your textbook in order to understand these concepts even better. The nursing process is composed of 5 steps. We have assessment, diagnosis, planning, implementation, and evaluation. The acronym we use for these steps is ADPI. Let's talk about assessment. What is assessment? Assessment is basically collecting as much data as possible on your patient. These are your cues. You use these cues to recognize patterns and make judgments, which help you to identify the type of health problem your patient is experiencing. And your initial assessment is very crucial because it not only helps you identify these health problems, but it also helps you to create a baseline for your patient. This is the way that we use clinical judgment and critical thinking in our assessment stage. We use our competence in critical thinking. We use our nursing knowledge, our past experience as a nurse, the environment we work in. Then we also use our critical thinking attitudes. Then finally the standards of practice, for example, and intellectual standards. The steps of assessment include data collection from primary and secondary sources and interpreting the data and validating it to complete the database. Now, collection of information from a primary source, which is the patient, and the secondary source from the family and caregiver and friends or health professionals, the medical record, are all equally important. And the interpretation and validation of the data is extremely important to determine whether we have enough data to complete the database or do we need additional data. As mentioned, primary data is subjective or objective. It's obtained directly from the patient, either through what the client says or what you observe. That's your primary data. And always remember, your patient is the primary source of data. Especially patients who are conscious and alert and able to answer questions appropriately will provide the most accurate information. Now, those patients who have cognitive changes, such as patients who are inattentive or easily distracted, or are dementia patients, or who have psychological symptoms such as anxiety, fear, they can be less reliable. And in situations like that, when they're not reliable, you can refer to the family. The individual identified as family and caregiver is preferred. A patient with limited health literacy will not always understand some of the questions you use during assessment, especially if you use more clinically focused words or terms or do not speak their language. You will not gather accurate information in that case. So if a patient does not understand assessment questions, or they do not have proper health literacy, or they're not alert and oriented, that can be a problem. In this case, you can do a quick assessment of the patient's health literacy first. Now, secondary data is obtained secondhand, for example, from the healthcare team, the medical record, or from the family or caregiver. The 2 different types of data. We have subjective data, that's information perceived only by the patient. They're also known as symptoms or covert data. Examples include the patient stating they feel nervous, or they feel nauseated or chilly, or they're experiencing pain. Objective data is observable and measurable data that can be seen, heard, felt, or measured by someone other than the person experiencing them. Examples, those are signs or overt data. Subjective data is symptoms, that is covert, and objective data is signs, that is overt data. So this is the data observed by one person and can be verified by another person observing the same patient. For example, a patient having an elevated temperature reading, or moist skin, or a patient being diaphoretic, or the patient having an elevated blood pressure. All of these are objective data. Then another step in assessment is once you've collected the data, you have to validate the data. Validation is the act of confirming or verifying it, and it involves identifying the cues, what the client says and what you observe, making inferences, that is, judgments and interpretations about what the cues actually mean. And these are your judgments about the cues. For example, cue would be an incision that's red, draining pus, the edges are separated, and inference is the incision is infected. So cue is something that you see and observe, and inference is a judgment that you make about what you saw. Now, there are different sources of assessments, different ways we can get assessment data. First is a patient-centered interview. This assessment is best when conducting a comprehensive nursing history to collect information about the patient's physical, psychosocial, cultural, spiritual, or lifestyle needs. Now, this is usually done when the patient is getting admitted. Then we have periodic assessments. These include rapid, quick bedside assessments. These are, for example, the assessments you do while you're rounding or while you administer patient care. That include quick screenings to rule out a follow-up on a patient problem. For example, in the ABCDE approach that's used in the emergency department is an example of that. Problem-focused periodic assessments, they begin when the patient presents with a specific problem or situation, such as pain. So if you go to assess the patient says they have pain, then you do a focused pain assessment, and then you take care of that issue. That's called a problem-focused assessment. And then once we gather the information from our patient interview and our assessments, we complement it with a physical assessment. Physical assessments can also be either comprehensive, head to toe, very detailed in a systematic way. These are usually done during admission again, or you can have a problem-specific assessment, which is also known as a focused assessment, physical assessment, which provides data about a specific problem that the patient has. These are some examples of problem-focused assessments. Please go ahead and read over this table. Now, these are the different types of assessments. As a nurse, we have to understand that assessment is a continuous process. And as a nurse, we do this all day. And this is a list of the different types. We have initial assessment. This is when the patient is admitted, you're collecting the data to get complete the database about the patient and identify problems. And usually done, like I said, on assessment, and you also create a reference or baseline for your patient. The focused assessments are done when you're collecting data about a specific problem. For example, it helps to identify new or overlooked problems. For example, you go to the patient, you're administering medication, and the patient said, "Oh, I have a headache," and now you assess their pain. That's a focused assessment. Quick priority assessments. These are short, focused, prioritized assessments. These are done to gain the most information needed first. It helps to flag existing problems and risks. Then we have emergency assessments. These are done when a patient presents with a physiologic or psychological crisis. For example, life-threatening. For example, you go in the room and the patient is unresponsive, or the patient is having difficulty breathing. These all call for an emergency assessment. Then we have time-lapsed assessments. These are scheduled to compare patients' current status to the baseline data obtained earlier. They can also be comprehensive or focused. Then we have triage assessments to determine the extent and severity of a problem and then recommend appropriate follow-up. So this is the kind of assessment they use in the triage area in the emergency department. Assessment skills and techniques. The nurse-patient relationship. A patient-centered interview is very relationship-based and is organized. It's an organized conversation focused on learning about the patient's concerns and needs. An interview can last less than a minute to several minutes. It's done to gather accurate information about our patient. You must make every effort to sense the world of the individual patient as the patient senses it. It's an empathetic, patient-centered interview. It strengthens our patient's sense of self-esteem and lessens the feelings of helplessness during a period of illness. Good interview skills include courtesy. You greet the patient by their name, the name that they prefer to be called by. You introduce yourself and you explain your role the first time you meet. For example, you say, my name is so-and-so, and I will be your nurse today, right? You ensure the patient that the information that they share will remain confidential. Meet and acknowledge visitors that are in the patient's room. Sit down next to the patient and do not make an effort to exit the room too soon. Don't rush the patient. Ask the patient's permission to conduct the interview in the visitor's presence, because sometimes patients might not want to answer all those questions in front if there are visitors in the room. Try to reduce computer time entering notes. For example, while the patient is talking, don't, constantly look at your screen trying to enter the data, because then you're not being present. Another skill that we need to have is comfort. Providing necessary comfort measures before beginning the interview. When patients have symptoms, keep questions short and focused. Maintain privacy. Select a location that is free from interruptions. Avoid making the patient tired. Right? You do not have to ask every single question, all of them in one setting, right? You can do it, like I said, the assessment process is continuous. Another skill that's important in interviewing a patient is connection, making a good first impression. Do not stare at the computer screen or on your, or your phone, because it makes it look like you're uninterested. Right? Allow the patients to fully describe their symptoms without interrupting them. Listen and be attentive, be observant. Note the patient's tone of voice, posture, level of energy when talking. Just by observing, nurses learn a lot about their patients. Respect the silence and be flexible and open-minded. Let the patient's needs and concerns or questions guide your interview. Then another skill that's very important to have is confirmation. This is at the end of the interview, when you ask the patient to summarize the discussion so that there are no uncertainties. Because remember, we want to collect data, but we want to make sure that the data that we collect is accurate and reliable. And this is the perfect way of doing it, is through confirmation. And by asking, just summarize it. So based on what we talked about, this, and let the patient say yes or no. Right? And then you always end by asking if there's anything else the patient wants to discuss. Now, the techniques of assessment, they include observation. Observation is extremely, extremely important. Open-ended questions. This helps to elicit the patient's story. When you ask open-ended questions, the patient will talk and you will learn a lot about the patient. Direct, close-ended questions. Sometimes you need these kind of questions to seek specific information about a problem, right? Then you have leading questions. Now, these can be risky sometimes because they can limit how much the patient shares, but sometimes we do need to use leading questions, like saying, so tell me about your headache that you've been having, so you're kind of leading the patient to talk a little bit more about the problem that you want to collect information about. Then we have back channeling. This is active listening prompts, such as, okay, go on, tell me more about it, so it helps, actually shows to the patient that you're listening and interested. And it also helps the patient, encourages the patient, to add more information. Then we have probing questions. This is when you encourage the patient to talk without controlling the discussion. Okay, so assessment environment. This is very important, is the environment setting. Ensure that the environment is, conducive to care and assessment, right? The time pressure, make sure you have enough time. Prioritize what you need to ask and do, because that will help manage the tasks. interruptions. Avoid interruptions. Try to make sure that you set a time to go do the assessment without rushing or being interrupted. Now, when you start the patient interview, there are different phases of it. There are 3 phases specifically. We have the orientation and setting phase, or orientation and setting an agenda phase, sorry. This starts when you begin by introducing yourself, explain why you are collecting this data, and that ensure them that it's going to stay confidential. It's important to set an agenda for the interview and explain how you will gather the information about the patient's chief concerns or problems. For example, asking questions and performing a physical examination. For example, if the patient says, okay, they have a abdominal pain, then you'll explain to the patient how you will assess this pain, right? You're going to tell them, okay, I'm going to observe, inspect your abdomen, then I'm going to auscultate it, and then I'm going to palpate it to see if, what's going on. So that way the patient is aware of what you're going to be doing, right? Then you use the interview skills mentioned in the previous slide. Do not rush the patient. An initial interview is very extensive, so make sure you have time, right? So this is your working phase. Then we have the termination phase. So once you've completed most of the interview, you did your orientation, setting the agenda, you have the working phase where you're gathering all the information and you're asking your open-ended questions and, stating the problems clearly. Then we go to the termination phase of the interview. This is where you summarize your discussion with the patient. Remember the confirmation part, and you check for accuracy of the information you collected. You do not want to put inaccurate information in the patient's database. Let your patient know when the interview is coming to an end. For example, you can just say, okay, I have just 2 more questions and we'll be finished with the interview in a few more minutes. That way they don't feel like, okay, this seems like it's never ending. Right? And so you can end the interview in a very friendly manner, telling the patient when you will return to provide care. The health assessment history components. This is the information that we're going to collect in our health history. This includes biographical data, for example, demographic data, age, gender, address, insurance information, occupation, working status, marital status, referral source. Then you're going to ask the patient about their chief concern, the reason why they're seeking help. And that's a brief statement in the patient's own words as to why they're seeking help. Then you want to collect information about the patient's expectations. What are the expectations from the healthcare providers, right? Example, are they here to get diagnosed for a problem? Are they here to get pain relief? Are they, looking to get treatment for a disease? Then another one is present illness or health concerns. This is where we collect all the essential and relevant data about the illness, the symptoms, and an example of that is the old cards, which we'll see in the next slide. The patient's health history is also very important. Their past hospitalization, their medical history, medication history, allergies, emotional status, habits, lifestyle patterns, any use of alcohol or drugs, any risks for disease, nutritional problems, exercise, coping patterns. Then you also want to know about their family history, immediate or blood relatives. This helps you to determine the risk for disease. Psychosocial history, the support systems, recent loss, stress or grief. Spiritual health, that includes their beliefs, rituals, religious practices. Then we want to do a review of systems. This is a systematic examination of all their body systems, commonly using the head-to-toe format. And the techniques we use for our head-to-toe will be inspection, palpation, percussion, and auscultation. Then the last one is observation, observing the patient's behavior, verbal and nonverbal signs. This is a quick diagram of the old cards. L-CART stands for onset, location, duration, characteristics, alleviating and aggravating factors, relieving factors, treatments, and severity. Now, this is a method that we can use with any problem that the patient has, whether it's abdominal pain, whether it's nausea, vomiting, any health concern that the patient is stating they're having. Other considerations are cultural, being very culturally sensitive, be respectful, understand their needs and differences. Professionalism, utilize good interview skills. And then be careful about, be considerate about the older adult. These are a few ways we can do that. By listening patiently, allowing for pauses and give them time to tell their story, recognizing normal changes associated with aging. Older adults' symptoms are often muted or less obvious, vague, or nonspecific compared with the younger adults. Some patients may not even report symptoms because they attribute them to aging, or they think nothing can be done for them. They think it's normal, but it's not. Right? So if a patient has limited hearing or visual deficits, then use nonverbal communication when conducting your interview. Accommodate for those sensory deficits. Always maintain eye contact with the patient. This allows you or a patient who's speaking to check whether information is understood. Right? And it is a signal for readiness to initiate interaction with the patient. Eye contact shows interest in what the other person is saying. The affirmative head nodding, that's also very important. This is actually very important social function. It helps to regulate interaction. It supports spoken language and allows for comments on the on the interaction. Smiling, a positive sign that indicates good humor, warmth, and immediate intimacy with your patient. It shows that you actually care, and it helps you to establish that nurse-patient relationship. Forward-leaning, this shows attention to the patient, and it shows that you care, and during the interaction it also suggests interest in the actual person. Finally, with assessment, after you've completed your assessment, it's important to document your assessment, and these are some considerations for documentation. Document as soon as possible. In the past we used to use written documentation, but if you're having to write something, write neatly, legible, and in black ink. Or, be careful with your spelling and grammar with your electronic recording. You always want to make sure that if you're quoting the patient's words, you always want to use quotation marks. It's very important, especially, and when you're recording your data. Only record the important patient words, right? And these are the ones, then of course you're going to put it in quotations, important in the sense of the relevant things. Sometimes patients will talk about their life or other things. You don't need to record all of that. Use concrete, specific information. Record your cues, what you're observing and seeing or hearing, not your inferences. I assume this is what the patient has. Cues are what the client says and what you observe. Inferences are judgments and interpretation about what the cues mean. So when recording the cues, you do not need to use words such as it appears as if, or it seems as if, the incision seems red. Document what actually is happening, the actual facts. There are different tools for recording data, and as we go throughout the semester, as we pass through the semester and you go for your clinicals, you're going to notice a lot of different ways that nurses document. We have graphic flow sheets such as vital sign logs. We have intake and output sheets. We have nursing admission assessment sheets. We have discharge summaries, special purpose forms, and electronic documentation. So this was it for assessment, and our next step is diagnosis.